Welcome back to Midday Kentucky, everyone. Well, the use of ultrasound is a popular treatment in the field of physical therapy. Joining me today for a live demonstration is Dr. Ron and also Dr. Jacob. Welcome back to the show, both of you.
Thank you.
Okay, I want to understand, having this system in your office, why?
Well, it's an excellent tool to help us see exactly what's going on real time in vivo as we're looking at things. So if we're looking at your shoulder or anything,
yeah,
and I'll jump here up on the screen. What you should see, it's hard to see through the camera.
Yeah.
But what we can see is we can look down in there and see what's going on with the muscles at the time. So if we're suspecting that there's a rotator cuff issue or something like that.
And that's what we're seeing on the screen now.
Yes, sir.
It's truly an ultrasound, a bit like an MRI, something that someone would have if you were pregnant. Is that correct?
It's pretty much the same machine, and typically in physical therapy we think of ultrasound as a heat therapeutic modality,
yes,
and this is different because this is a diagnostic imaging modality,
okay,
which allows us to see the problems that we're trying to diagnose versus just testing them with our hands.
What we're looking at on the screen here now, if you just look over to the monitor behind the cameras, what am I looking at? To everyone at home, explain that.
Right now we're looking at his shoulder, if you don't mind to put your hand up like this.
Okay.
And what you should see, it's hard to see through the cameras, but on this we see...
No, we can see it, yeah.
This bright line through
Yeah.
here is the bony structure.
Oh, wow.
And then as we see, we have muscle overlaying on top of that, and then some subcutaneous tissue, and then the skin there.
I'm glad you used that word. I wouldn't have got that out. Okay, that's interesting. I love seeing all this sort of stuff. But I want to ask you, what am I looking for?
Ultimately, when we're diagnosing or we have a referral or somebody comes into our clinic, we are assessing for tears in the tendons or tears in the muscles or tendonitis or bursitis, inflammatory issues going on inside the tissue.
Okay.
And our ability to determine those from our normal physical therapy testing is not that great according to the research. So this allows us to see underneath the skin,
which we can't see with the human eye.
and we can't really test it that well with our testing abilities.
So
we can see.
me in my head, in layman's terms, as you're telling me this, I'm thinking to myself, if that's the case, you could prevent us having major surgery by predetermining what the issue is.
Well, I think what it is it's a great...
Is that right?
I think it's a great tool and a cost savings tool for patients to perhaps prevent the need for more expensive MRIs. And then if there is something that's not major that we don't need to refer to the primary care physician or an orthopedist,
I got you.
then surgery is not necessary because we've already seen with our own eyes what's going on. But if there is something major, then we refer them to their primary care physician or their orthopedic surgeon or whomever it is for further workup, which then becomes a little further down the road.
And with that, there's no radiation as you would get with an X-ray. You can see the soft tissues much better than you can with an X-ray. You can see it real time and as it's moving, which you can't with an MRI. And so it's very, very easy, very quick to do, and we can find what we're looking for. It can help us decide if we give you a better idea of how long your treatment's going to last.
Okay.
Like that.
These are really important questions. Is it covered by health insurance to begin with?
It is covered by health insurance.
Okay.
And as this being a new intervention in our clinic, and I don't believe there's any other PT practices in Central Kentucky offering this, insurance will cover it, or if not, then we will do it on our own because it helps us to treat patients better, whether we're reimbursed for it or whether we're not. And that's still kind of in the learning process.
Okay, doctor, I want to say to you, do I need a referral from my GP to have this process done?
In Kentucky, we have direct access to patients, which means you don't need a referral from your doctor or your general practitioner. Now, some insurances will require that you need that, but we can sort that out and find that out for you.
Yeah.
And it's typically as quick as sending over our findings to your doctor.
I love this, everyone. It's super important. And what a great little kit to have for physical therapy as well. We appreciate both of you coming in. If you want to find out more information about Advantage Osteopractic Physical Therapy, as we say here, AOPT, that's the way it is, everyone. There's their phone number. Email Dr. Ron as well. Great information, really great. Loved it. We've got more holiday survival tips from Josh McBride coming up after the break, everyone. You're watching Midday Kentucky. Stick around.